class. Welcome back to our anatomy and physiology lecture for this week. We are discussing the axial skeleton. This is week 6 if you're in a 15-week class and week 4 if you are in a 12-week class. So the axial skeleton makes up the longitudinal or long axis of the body. So when you're standing upright, it's the whole central structure starting from your skull up here, coming down your spine and ending with your sacrum. It does not include your pelvic bones. That's going to be something important that'll come up over the next couple of weeks. So it does not include the pelvic bones. So skull, ribs, vertebrae, skull, vertebral column, so all the vertebrae, and the thoracic cage, which is the ribs and the sternum. There are 80 bones that make up the axial skeleton, and that's something that I would know. So it is about 40% of the bones in the body are contained within the axial skeleton. So these next few slides are highlighting the different bones and pointing them out to you, and I want you to certainly utilize, I guess it's just this slide, when we get to appendicular skeleton, there are multiple pictures. So utilize this to go back and just have an idea of where all of these bones are. And what we're going to do is we're going to look at each of these bones individually and regionally. So the axial skeleton has multiple functions. It supports and protects the organs in body cavities. So the rib cage is supporting the protecting the heart and the lungs. The liver is up under the rib cage, the spleen, the stomach is sort of protected by the rib cage, and then the sacrum, along with the pelvic bones, is protecting the lower digestive system, the bladder, the uterus. All of those things are being protected by the sacrum, and then with the addition of the coxal bones, which are part of the appendicular skeleton. It also functions to attach muscles of the head, the neck, and the trunk, muscles of respiration, which are the muscles that allow us to breathe, and it is for the attachment of muscles of the appendicular skeleton. So we need our arms and legs to be attached into our body, and so they are attached from the appendicular skeleton into the axial skeleton. The skull functions to protect the brain. That's super important. The brain is the central functioning system of your body. It tells all of your other systems what to do and when to do it. And so it is protected in its bony encasement. Something that you'll notice with bones is when something is highly protected, that means it's extremely important. And so the brain is extremely important, so it is completely encased in bone. It also protects entrances to the respiratory system and the digestive system through the nose and the mouth. The skull itself contains 22 bones. Yes, that is a lot of bones. Many of them are paired, so we don't have to learn 22 individual bones, but we're going to learn quite a few different bones. You have 8 cranial bones that form your brain case or your cranium or calvaria, and then 14 bones that form your face. So we're going to want to learn what the bones are of the calvaria and which ones are facial bones. So here are some pictures. I like to use these pictures. You want to be able to just look at where the different bones are. So the frontal bone is in the front, which makes up your forehead. The parietal bone makes up either side of the top of your head. And the occipital bone makes up the back of your skull. And those bones, the frontal bone, the 2 parietal bones, and the occipital bone make up the calvaria. So those make up the cranial bones. And we're going to learn about how they're all connected together. The temporal bone, which you see here, is on the side of the head. So come back to this picture and utilize it to as a study tool. The cranial bones, as we already said, enclose the cranial cavity, which contains the brain, plus all of its fluids. It's surrounded in cerebrospinal fluid, all of its blood vessels and nerves, and then there are membranes as well that surround the brain. And when we get to the nervous system, we're going to learn what all of those are. Our facial bones, we have two layers of facial bones: superficial facial bones, which are for muscular attachment, and then deeper facial bones, which are separating the oral cavity from the nasal cavity and forming the nasal septum, which is that the separation between your two nostrils. So again, here are some pictures. I'm going to go through these and get back to the slides where we have the information, but these are for you to utilize for studying. All right, so facial bones, our superficial facial bones are the maxilla, the lacrimal bones, the nasal bones, the zygomatic bones, and the mandible. And the deep bones are the palatine bones, inferior nasal conch, and the vomer. So more of the facial bones are superficial, 3 of them are deep. Within some of these facial bones, we have sinuses, which are cavities within the bone itself. They have multiple functions. They decrease the weight of the skull. If your skull bones were all compact bone, your skull would be much heavier. They're lined with mucous membranes, and they protect the entrances to the respiratory system and serve as resonating chambers for speech production. So when you breathe in, that air goes up through all of your sinuses, which creates turbulence and resonates into your resonates for your speech. So it allows you to really affects your voice. You might notice that if you have a cold and your sinuses are sort of plugged with mucus, your voice changes. And so that's because it doesn't have that open space for resonation. The maxillary sinus, which is here in the cheekbone, those are your largest sinuses. Between the bones of the skull, we have sutures, and sutures are really just where two bones come together. They're not fused together. There is still some slight movement in there, but it is where these two bones meet in the skull. So the main sutures are the lambdoidal suture, which you'll see here. The lambdoidal suture separates the occipital bone from the parietal bone. Then we have the coronal suture here, which separates the frontal bone from the parietal bone. The sagittal suture, which you can't see in this picture, but it comes down like this and separates the two parietal bones from one another. And then the squamous suture, which I'll do in a different color, which is here, the squamous suture separates the temporal bone from the parietal bones. So coronal suture is here, sagittal suture up on top, squamous suture between temporal bone and parietal bone, and then lambdoidal suture between the occipital bone and the parietal bone. So we're going to learn about the bones. I always feel like I should switch that around and teach you the bones first, but we'll get there now. So the cranial bones are the occipital bone, the two parietal bones, frontal bone, the two temporal bones, one sphenoid, and one ethmoid. So we'll look at these each one at a time. So the occipital bone makes up the base of your skull. So if you run your hand up the back of your neck, you're going to hit a round base of your skull, and that is your occipital bone. It is the posterior and inferior surface of the cranium. So when we're learning these bones in the skull, there is a ton of information. There's a lot in this lecture, and there's even more in your book. So I want you to focus on what I'm telling you that I care for you to learn. In general, you do not need to know all of the little canals and the foramen and all of those things in the skull, because that is beyond the scope of undergraduate anatomy and physiology. The one foramen you do need to know is the foramen magnum. Maybe I'll do that in red or orange. No, it really doesn't want to show it. So this is the foramen magnum. The foramen magnum is the largest hole in the occipital bone, and your spinal cord passes through that hole to go down into your spine. Let me back up. So articulations of the occipital bones. So what you want to do when you're looking at these bones is think of what are all of the different bones that articulate with this one particular bone. So for the occipital bone, it is articulating with the parietal bones along the lambdoidal suture, with the temporal bones along the bottom of the lambdoidal suture, and then with the sphenoid bone. And the sphenoid bone, it articulates right up here in the very front. So that's the one that people usually can forget about with the occipital bone, is that in the very front part of the occipital bone, it does articulate with a small part of the sphenoid bone. And then it also articulates with the first cervical vertebrae. So that is the top vertebrae in your spine. And that articulation comes here with these occipital condyles. So the skull sits on top of the spine, and it has those occipital condyles, which are articulating surfaces between the occipital bone and the first cervical vertebrae. Marks on the occipital bone, we have the external occipital protuberance, which is right here, which you can feel if you sort of run your fingers up the back of your skull. You'll feel a prominent bump right there. That's your external occipital protuberance. And below that is the external occipital crest, which just comes down to the foramen magnum, and that's for ligamentous attachment. The occipital condyles I already talked about, you find here, and those are for articulation with that first cervical vertebrae, which is also called the atlas. And then there are superior and inferior nuchal lines. So this is the superior nuchal line, and this is the inferior nuchal line, and those are for attachments of muscles and ligaments of the neck. So as the muscles come up your neck, they have to attach into your skull to hold your skull back so that you can look straight ahead. If you didn't have muscles in the back of your neck would just flop down and you'd look at the floor all the time. So the muscles in the back of your neck are going to attach to those superior and inferior nuchal lines. And then the foramen I want you to know is this foramen magnum, which is this large hole in the center for the passage of the spinal cord. The other ones I really don't want you to know at this point. If you want to learn them, awesome. Maybe in your, especially if you're studying neuroscience, definitely get a jump on that and learn them now. But for the purposes of my quizzes and exams, I will not ask them. They might show up on your homework, and you can utilize your book to for those questions. All right, so that was the end of the occipital bone. So we're going to move on to the parietal bone. So in this small picture here, it sort of shows you where that bone is. So we just did the occipital bone back here, and now we're moving on to the parietal bone, which is shown in pink. So the parietal bones form the superior and lateral surfaces of the cranium. So if you were to put your hands on either side of the top of your head, you'd be covering your parietal bones. The parietal bones articulate with one another. They articulate with one another at the sagittal suture. They articulate with the occipital bone at the lambdoidal suture. They articulate with the temporal bone at the squamous suture. I'll show you on this picture. There's the squamous suture. They articulate with the frontal bone at the coronal suture here. And they also articulate the very small portion of the sphenoid bone, and that is occurring right in that region there. So where that pink comes together with the white, that is where the parietal bone articulates with the sphenoid bone. Okay, so I'm not sure if this just recorded everything I just said about the frontal bone, so I'm just going to start over. So the frontal bone makes up the front portion of your forehead, and it contains the frontal sinuses, which you find in those areas. You can see that it has the upper eye sockets here and the bridge of the nose there. And And the last piece that I was discussing was this metopic suture, which is where the multiple pieces of the frontal bone, which form independently, come together and fuse. In some people, they don't fuse fully, and they leave this metopic suture, which appears like a crack in the bone. Whereas in other people, there's no evidence of that whatsoever. It's a normal variant. It doesn't make you special if you have it, or maybe it does make you special if you have it, but it doesn't make any real difference in your life, but it's something that I do want you to know, what the metopic suture is and where you find it. The frontal bone articulates with the parietal bone at the coronal suture, and then it also articulates with multiple other bones, the maxilla, the ethmoid, the lacrimal bone, the zygomatic bone, the sphenoid, and the nasal bones. Some other things that I would like you to know about the frontal bone are the supraorbital margin. That is this margin along the top of the eye socket, which is also called the orbit. So that's the supraorbital margin. That helps to protect the eye. The glabella is it's between the superior orbital margins here, and it is the most forward projection of the frontal bone. So if you feel down your forehead, you'll feel that it sticks out right there between your eyes, and that is your glabella. And then you also have above the eye socket right here is either the supraorbital notch or the supraorbital foramen. And that is for the passage of blood vessels. So in some people you have a foramen, which would be a hole going through the bone, and in other people you have a notch, which does not have that bony coverage on the very bottom. And you can determine on yourself what you have if you start with your thumb and you palpate or feel along through your the underside of your superior orbital margin. If you feel a little notch in there, then you have a notch. If it feels very smooth to you, then you have a foramen. I personally have a notch on the right side and a foramen on the left side. And so again, like the metopic suture, it doesn't mean anything if you have one versus the other, but whenever you can feel something on your own body, I like to give you that sort of connection there. All right, next is the temporal bone. The temporal bone has a bunch of stuff on it. So the temporal bones make up the lateral walls of the cranium and the zygomatic arches. They are not included in the calvaria, so that's important. They articulate with the mandible. They are the only bone that articulates with the mandible, which is the lower jaw bone. They surround and protect the inner ear and attach muscles of the jaw and muscles of the head. There are different parts of the temporal bone. The squamous part is this upper part up here, and that comes up to connect in with the parietal bone at the squamous suture. The mandibular fossa, you can see right here, that's where that upper part of the mandible comes in and articulates with the temporal bone. The zygomatic process here sticks out and forms the back part of your cheekbone. So if you feel along your cheek and you kind of feel backwards and kind of pinch the other side of the bone there, the front side is the maxilla, or the front side is the zygomatic bone. The back side is the zygomatic process of the temporal bone. So the zygomatic process of the temporal bone articulates with the temporal process of the zygomatic bone. I know that's a mouthful, but look at that when you're looking at these pictures and seeing how everything comes together. The part that I'm discussing is right there, where the pink temporal bone is coming together with the white zygomatic bone, which makes up your cheekbone. So the zygomatic process of the temporal bone connects to the temporal process of the zygomatic bone to make up your cheekbone. And they collectively form what's called the zygomatic arch. The mastoid process is down here. That is for muscular attachment. The sternocleidomastoid muscle attaches to the mastoid process. It contains mastoid air cells, which are right behind the ear. And when you have bad ear infections, you can end up with mastoiditis, which is an infection of those mastoid air cells. And that's a dangerous complication of ear infections. If you have a skull fracture, you can also end up with bruising below your mastoid process, and that's called Bedel's sign. The styloid process, I'm going to highlight the name here because it's hard to circle that, but it's this little thing, little skinny process that's poking out the bottom of the bone. I'll erase that so you can see it now. The styloid process, and that attaches tendons and ligaments that attach to the hyoid bone, the tongue, and the pharynx. The petrous part of the temporal bone is on the inside of the temporal bone, so it's inside the skull, and it encloses the structures of the inner ear. And the auditory ossicles are the little bones that are within the middle ear that convey sound. So they transfer sound from the tympanic membrane, which is the eardrum, into the inner ear. You have 3 of them. They are called the malleus, the incus, and the stapes. And you're going to learn more about those week 1 of AMP2 when you learn special senses. So here is the petrous or petrous part of the temporal bone. Now we're looking at the inside of the temporal bone here. Let me see what I'm going to show you. So the ear itself is made up of the external acoustic meatus, which was shown on the last slide. It is right in front of the mastoid process. And the internal acoustic meatus, which is shown right here. So there's basically a hole that comes into the bone and a hole that goes out of the bone into the interior of the skull. So those are the external acoustic meatus coming into the temporal bone at the ear, and the internal acoustic meatus, which is leaving the middle ear and coming into, or leaving the inner ear and coming into the cranial cavity. Those are the only 2 foramen that I expect you to know in the temporal bone. This picture is showing the mastoid air cells, or the mastoid sinuses, which are here like that. The external acoustic meatus is right in front of that. So that's where that's the entrance of your ear. And so those mastoid air cells, this part of the mastoid bone has been resected so you can see in and see what that's what sinus looks like. Sinuses are that sort of open network of bone. Next we have the sphenoid bone. The sphenoid bone looks kind of like a bat with its wings out. It forms part of the floor of the cranium, and it unites the cranial bones with the facial bones and gives strength to the skull from pressure from the sides. So if somebody were to sort of put their hands on either side of your head and squeeze, the sphenoid bone is the bone that keeps your skull from crushing inward. So that's very important. There are sinuses within the body of the sphenoid here. The lesser wings are this inner part here, like that. And then the greater wings are this outer part here. So we have greater wings and lesser wings, if we're looking at this like a flying bat. The pterygoid processes are these longer parts that stick down here. I'm hoping that we're going to get a better picture. We are. Okay. In a second, I think we're going to see the backside that has the most important part that I want you to know. I do not expect you to know any of the foramen that are within this bone. So this is the backside of the sphenoid bone. So if you're looking at this picture over on the top right, you can see the sphenoid bone is in purple. So it forms the base of the inside of the cranial cavity. And the most important structure on the sphenoid bone is right here in the center. It's called the sella turcica, and it looks like a little saddle. It's saddle shaped. And I wish that we could be in class together looking at this skull because it's easiest when you actually can look, touch, and feel it. But we're online, so you'll have to look at multiple different pictures to really gauge what does this look like inside. So the importance of the sella turcica is that it holds the pituitary gland. And remember that I said anything that has its own bony case is very important. And the pituitary gland is arguably the most important gland in your body. It secretes 9 different hormones that are extremely important for multitudes of functioning. And so it has its own bony case within the cranium. And the floor of the sella turcica is called the hypophyseal fossa. So the pituitary gland sits in the hypophyseal fossa within the sella turcica. The ethmoid bone is just anterior or in front of the sphenoid bone. You can see in this picture it's a very small green spot there. So while this picture makes it look big, it's actually very small. It forms a portion of the floor of the cranium and the roof of the nasal cavity, part of the nasal septum. So this perpendicular plate here forms part of the nasal septum, and it contains ethmoidal air cells or ethmoid sinuses. There are 3 parts of the ethmoid bone. The cribriform plate, which is here, forms the floor of the cranium and the roof of the nasal cavity, and it contains a structure called the crista galli. And the cool thing about the cribriform plate is you can see all of these little holes that are in this cribriform plate, and those holes are for the passage of the olfactory nerves. So the little nerve endings for your sense of smell, the olfactory nerve passes through this ethmoid bone. And if you are punched in the top of the nose and you break your ethmoid bone, you can shear off those nerves and lose your sense of smell, which is awful, but I think it's totally interesting. So I like to share that. There are also 2 lateral masses, which are here, and the lateral masses is where the ethmoid sinuses are. And then the perpendicular plate, which I already showed you, forms the top portion of the nasal septum. So that concludes our cranial bones. We're going to move on to facial bones. So facial bones, you have 2 maxilla or maxillary bones, 2 palatine bones, 2 nasal bones, 1 vomer, 2 inferior nasal conch, 2 zygomatic bones, 2 lacrimal bones, and 1 mandible. So that is what makes up the facial bones. The maxilla supports the upper teeth, forms the inferior rim of the orbit, so the inferior eye socket here, forms the lateral margin of the external nares, so the lateral margin of the external nose right here, the upper jaw and the hard palate here, and it contains the maxillary air sinuses, which are the largest sinuses. And you can see in this picture that it goes from the nose out, hold all of the teeth, and so the two maxilla come together in the very center of your face. So the orbital rim protects the eye. The anterior nasal spine is here, which attaches the cartilage. Actually, sorry, it's like just this little point there. It attaches the cartilage of the anterior nasal septum. The alveolar processes are here. So that's what holds your teeth. So all of the teeth are held in by alveolar processes. The palatine process forms the hard palate, which is the roof of the mouth. So you can't see that in this picture. It is underneath, inside the, between the teeth. The maxillary sinuses are deep within the bone, which lighten the bone and resonate with speech. And the nasolacrimal canal protects the lacrimal sac and the nasolacrimal duct, which are coming in like through here, and those are portions of your tear glands. The palatine bones are L-shaped bones. So this picture here is showing you two bones. So this is one bone on the right side. Sorry, that's ugly. Let's try this again. That's one bone, and then this is the other bone. All right, so the palatine bone is shaped like an L. It forms the posterior portion of the hard palate. So the hard palate, again, forms the roof of your mouth. So the anterior 2/3 of the hard palate is formed by the maxilla, and the posterior 1/3 is formed by the horizontal plate of the palatine bone. So the palatine bone has this horizontal plate here, and then it has the perpendicular plate here. So the horizontal plate creates the posterior 1/3 of the hard palate. The perpendicular plate forms the orbital process, let me try to speak English. The perpendicular plate from the horizontal plate to the orbital process of the orbital floor. So here's the orbital process. So part of that makes up the floor of the eye socket. There's a picture later where it's going to show you the inside of the eye socket and show you that just about every facial bone makes up some little portion of the eye socket. I will not ask you, which one of these bones does not make up the eye socket. That's really a nitpicky question, but looking at that picture really helps you to understand how the bones are situated in relation to one another. Don't worry about the foramina. So for the palatine bones, I want you to know the horizontal plate, the perpendicular plate, and that it makes up this would be the lateral wall of the nares, and then this part of the eye socket. The nasal bones are little tiny bones. They form the bridge of your nose. There's two of them, and they connect, so they articulate with one another. They articulate with the frontal bone, and then also with the maxilla and the ethmoid bone. And they connect to the cartilage that makes up the external nares. So what makes up the structure of your nose is mainly cartilage, and that cartilage comes in and attaches into the nasal bone. The vomer is a singular bone. It makes up the most of the bony portion of your nasal septum. So the ethmoid makes up the superior portion of the nasal septum, and the vomer, which you can see right here, makes up the inferior portion of the nasal septum. So it separates the two nostrils and the two sides of the nasal cavity. The inferior nasal conch, you can see down here, it's sort of projects into the nasal cavity on either side. And there are three nasal conch. The inferior one is its own bone. The middle and superior nasal conch are part of let's see. Oh, now I'm missing it in my notes. But I believe they're part of the ethmoid bone, but maybe don't quote me on that yet. So the purpose of the conch are to humidify inhaled air and warm it, and to increase epithelial surface area. So you have mucous membranes in there that are going to trap any bacteria or particles that are coming into your body that shouldn't be coming into your body. It can trap them in the mucus, and then you can expel them from your body. The zygomatic bones make up your cheekbones. So here, like that. They contribute to the rim of the orbit. So part of the eye socket is made up of zygomatic bones here, like that. And they form part of the zygomatic arch with the temporal process of the zygomatic bone, which is meeting the zygomatic process of the temporal bone, as we spoke about earlier. So it's making up the bulk of your cheekbone is zygomatic bone, like this. The lacrimal bones are the smallest facial bones. They form part of the medial wall of the orbit, so they are just inside the nasal bones. In there are the lacrimal bones, teeny tiny little bones. The mandible forms the lower jaw, and it's got multiple different things that we want to know about it. So it articulates with the temporal bone at the here at the head. So here we have the head of the mandible, which articulates into the mandibular fossa on the temporal bone, which you can see here. This is the condylar process, and this whole portion here is the ramus. So you remember that a ramus is a part of a bone that comes off of the rest of the bone at an angle. So you can see that this is the body of the bone, and then the ramus goes off at an angle. So this whole part here is called the ramus versus the body. This is the mandibular notch here, and it goes from the head to the tip of the coronoid process. So that is the coronoid process here. We also have alveolar processes, which are holding in the teeth, and the mental protuberance, which is the very front part of your chin. And then back here is the angle of the mandible, which makes up the angle of the back of your jaw. So the joint between the mandible and the temporal bone is called the temporal mandibular joint, which most people refer to as the TMJ. So if you say I have TMJ, everybody has a TMJ, which is the temporal mandibular joint. But if you are saying it as a dysfunction, then you have dysfunction of the temporal mandibular joint, which is pretty common. I believe that is everything I wanted to tell you about the mandible. So we're going to move on. The hyoid bone is a little bone in the front of your neck. It functions to support the larynx and attach the muscles of the larynx, the pharynx, and the tongue. It's got a body here. Oops. Here's the body, a tiny lesser horn, and a larger greater horn. That's all you have to know about the hyoid bone. So this is the picture I was talking about earlier with the orbital complex, where you can see all of the different bones that make up the orbital complex. So just take some time to look over this and see if you can really gauge how these bones are connected in with one another. There are 7 bones that form each orbital complex. The nasal complex is similar. So this is showing you a cutaway where the skull has been cut down the midline. And so you're looking at the inside of the mouth here, and this is the inside of the nose up here. So we've got the, for the conch, this is the inferior nasal conch here. Oh, I was right. See, ethmoid bone. All right. So the superior and middle nasal conch are both in the ethmoid bone there. So those all work together to create turbulence, to warm and humidify that air, and to trap bacteria in their mucous membranes. You can also see the bony palate here and how the anterior 2/3 is made up of the maxilla, and then the posterior 1/3 is made up of the horizontal plate of the palatine bone. And then the sphenoid bone is behind, and you can see on this picture nicely, this is the sella turcica that is holding the pituitary gland. So your brain is housed up in here, like that. Well, it's kind of bigger than that. It goes back this way. But there you have it. This is a picture, a slice of an actual cadaver, showing you what all of this looks like in real life. So here we have the tongue in the oral cavity, and here you can see those nasal conch, and these are the eye sockets, the frontal sinuses. So I think that's a pretty cool way here. This picture is showing you where they took that section. As the skull develops in infancy, it grows really rapidly, and it begins with multiple different bones. They begin as their dermal bones, so they have many different ossification centers within the dermis. And so you can see that your frontal bone here, it's showing you 2. I believe you start with 4, no, I guess 2 frontal bones, 4 occipital bones, and multiple sphenoidal and temporal elements that all eventually grow together. So we have fontanelles, which are the soft spots that you find in an infant's skull. So the fontanelles are the spaces between these individual different pieces of the bones, where you can actually, if you look closely or feel them, you can feel the pulsation of the blood underneath there. So the fontanelles are the anterior fontanelle here. Well, let's see, the next picture is going to show them. And all right, so we saw the anterior fontanelle on the last picture. The occipital fontanelle is where the lambdoidal suture and the sagittal sutures come together. So that's going to be back here. The sphenoidal fontanelle is going to be here, where the parietal bone, the frontal bone, and the sphenoidal bone come together. And then the mastoid fontanelle is above the mastoid process, where the squamous suture and the lambdoidal suture come together. So those are your fontanelles. You have to be very careful with those with infants because they have no bony protection for their developing structures inside the skull in those regions. All right, we made it through the skull. That's the hardest part of bone, I think, is the skull. There's so much to learn, and it's in such a compact area. So definitely take some time time to go over each of those bones, know what they attach to, and what their major features are that I discussed. So don't worry about the little hole and foramen and all of those things, except for the foramen magnum and the external and internal acoustic meatus. All right, so we're moving on to the spine. The spine is also called the vertebral column. It is a column of vertebrae. Its function is to protect the spinal cord, support the head and body. It's made up of 26 bones, which are 24 vertebrae, 1 sacrum, and the coccyx. And the coccyx is one bone, although it originates as 5 separate bones, so 3 to 5 bones. But the way that we look at the vertebral column is 24 vertebrae, 1 sacrum, 1 coccyx. So there are 4 different regions of your spine. The cervical region is the neck. The thoracic region is the mid-back. The lumbar region is the low back. And then the sacral and coccygeal region is sort of the tail. I want you to know these numbers. Basically, know everything on this slide, okay? The neck has 7 cervical vertebrae, so you have 7 vertebrae in your neck. The thorax or thoracic spine has 12 vertebrae, and each of those 12 vertebrae articulate with 1 or more pairs of ribs. You have 12 sets of ribs for a total of 24 ribs. But each thoracic vertebrae articulates with 1 or 2 sets of ribs. The lower back, the lumbar region, has 5 lumbar vertebrae, and then you have 1 sacrum and 1 coccyx. So please do know those numbers. Our spine has curves in it. You can see we have 2 curves that go this way. There, that way, and then 2 curves that go this way. So the thoracic curve and the sacral curves are these ones, thoracic curve and the sacral curve, and those are your primary curves because they're present at birth. Traditionally, I would ask you, why do you think that those are present at birth? What is their function? And the answer to that question would be, it puts you in fetal position, which protects all of your internal organs. So when a baby is in utero, they're curled around their internal organs, and that is for protection. So these are also called accommodation curves because they are accommodating those internal organs. The cervical curvature and the lumbar curvature are secondary curves because they develop after birth. As you start to sit up and then stand up, they develop in order to allow you to walk on 2 feet and keep your head level. So they're also called compensation curves because they're compensating for the weight of your body and allowing you to be in an upright posture. So do know the difference between which curves are the primary curves and which curves are the secondary curves. Here are some abnormal curvatures. This is a kyphosis or a hyperkyphosis. Kyphosis is when the thoracic curve and the sacral curve are kyphotic in nature, so they're causing you to lean forward. Whereas the lumbar curve and cervical curve are lordotic in nature. So this person has too much of a lordosis, so too much of a backward curvature of the spine. And then this last person has a scoliosis, which is a lateral curvature of the spine. So this is a pretty severe scoliosis. You can see that these ribs are rotated posteriorly, whereas these ribs are rotated anteriorly. You can see this right scapula is poking out. You can see there's a big difference in the shoulder height. So I realized that I just drew that. I have a cat jumping on me. So there's my horizontal line. So the left shoulder is higher than the right shoulder. And so this side actually could end up compressing on the lungs or compressing on the liver and interfering with function of those organs. So scoliosis can be very serious. It's most serious when it progresses. It progresses the most between age 12 and 16. It's found more so in girls, but it is often also found in boys. And so that prepubescent and puberty age is when it tends to progress the most. Once you reach skeletal maturity, the progression tends to slow way down. So if you need to interfere, you need to do it during that pubescent time. So we're going to look at the sort of common structures of vertebrae, and then we're going to look at some individual vertebrae that are different from the norm. So looking at a sort of normal vertebrae here, we have the vertebral body, which is this part in the front, that transfers the weight along the spine. So it really holds most of the weight of the body. When you're sitting down, all of your weight is on those vertebral bodies. And in between the vertebral bodies is where we find our vertebral discs. And then the vertebral arch is this part back here. I guess I could do that in a different color. So this is the vertebral arch. That's not the color I wanted. There we go. So the vertebral arch forms the posterior margin of the vertebral foramen. So this is a foramen I do want you to know. This foramen, the vertebral foramen, is for the housing of the spinal cord. The articular processes, which you'll see here and here, are the areas in the back of the vertebrae where two vertebrae come together. So you have a joint at those articular processes, and then you have joints at the vertebral bodies. The vertebral arch has multiple parts to it. The first part is the pedicle, and the pedicle connects the vertebral body with the transverse process. So that's the transverse process in red. The spinous process is in green here, and the lamina, which is in blue, the lamina here connects the transverse process to the spinous process. So you've got vertebral body, pedicle, transverse process, lamina, spinous process, lamina, transverse process, pedicle, vertebral body. That's not a ugly picture, but hopefully you get the point. On the back side, we have these articular processes. The articular processes, you have superior articular process and an inferior articular process on either side of each vertebrae. So the superior articular process of one vertebrae is going to articulate with the inferior articular process of the vertebrae above. So there would be another vertebrae here. I was trying to do that in red. And here's the spinous process. So the inferior articular process of the superior vertebrae would come down and articulate with the superior articular process of the inferior vertebrae. So try to get all those words straight in your head. These flat spaces where the two bones come together at the joint are called the articular facets. Those are facet joints because they are flat articulating surfaces. So in general, we just call those the vertebral facet joints versus the intervertebral joints, which are between the vertebral bodies. The vertebral column is when you stack up multiple vertebrae together, it makes up the vertebral column. So the intervertebral foramina are holes that are in between each vertebrae. So we talked about the vertebral canal, the vertebral foramen, which was the hole that allows the passage of the spinal cord. The vertebral canal is this central piece here where all of those vertebral foramen line up and the spinal cord traverses down the spine. But then you also have intervertebral foramen, which are here, and those are holes between each vertebrae itself. And those intervertebral foramen are for Xing spinal nerves. So vertebral canal houses the spinal cord. Intervertebral foramen is for the passage of spinal nerves, which are leaving the spinal cord at every level. Intervertebral discs, you can see here, are in between vertebral bodies, and they are used for shock absorption and keeping those vertebral bodies from rubbing upon one another. Regions of the vertebral canal, we have the cervical region, the thoracic region, the lumbar region, the sacral region, and the coccygeal region. We discussed that earlier. And we're going to look at each region and some of the specifications of the vertebrae in each region. So the cervical vertebrae are the smallest vertebrae. They're small because they only have to carry the weight of your head, whereas the lumbar vertebrae are carrying the weight of your entire upper body. There are some special vertebrae in the cervical spine. C1, which is the first cervical vertebrae, is called the atlas. It has no spinous process and it has an arch. I'll show you that in a minute. All of the other vertebrae have short spinous processes, and the tips of them are called bifid or bifid, and that means that it comes to 2 points instead of 1 point, and that only happens in the cervical vertebrae. The costal processes are fused to the transverse processes here, making this transverse foramen. And the transverse foramen is for the passage of the vertebral artery. And that's very important because remember, if something has its own bony encasement, it's very important. The vertebral artery is one of the main suppliers of blood to your brain. So they have their own bony encasement within the cervical spine. So that is made from a fusion of the costal process here with the transverse process here. All right, so here's the atlas. C1 articulates with the occipital condyles of the skull, and so that happens in those condyles there. It has no body and no spinous process. You can see it just has this big posterior arch and then a large opening in the center. It has a ligament here called the transverse ligament, which wraps around this process here, which is part of C2, the second cervical vertebrae. And we're going to talk about that one next. So this is the anterior arch, and this is the posterior arch, and there are transverse processes with the transverse foramen, but no body and no cervical vertebrae, and it articulates with the occipital condyles of the skull. The C1 allows you to rotate your head, so you can look right and left, and that is rotation, and that is from the action of C1 rotating like this and like that around C2. C2 is the axis. The axis supports the atlas, it supports C1, and it has a heavy spinous process, so it has the largest spinous process in the cervical spine. You can see that that spinous process is bifid or bifid. It has it comes to like 2 points there. And it has the Dens process. So this is called the Dens process. And the Dens process is actually the body of C1, but during development, it fuses to C2 and becomes this Dens process. So the C1 can rotate around this Dens process. C3 to C6 are all pretty similar, small body, small vertebrae, bifid spinous process. And then we come to C7, which is called vertebra prominens, because it has the most prominent spinous process of any of the cervical vertebrae. So if you feel the back of your neck and you start at your skull and you come down, first you're going to fall into like a little divot. If you look forward or like tilt your head forward and then tilt your head backwards, if you feel some movement in that divot, that's where C1 is. Just below that, you're going to feel a larger bump. That is the large spinous process of C2. And then if you slide your finger down to the bottom of your neck, you're going to feel a big bump, and that is this vertebra prominens with that large spinous process. Wherever we find two parts of the spine coming together, like the cervical vertebrae coming to the thoracic vertebrae, we have transitional areas. So the cervical vertebrae are starting to look more like thoracic vertebrae, and the lower thoracic vertebrae are starting to look more like lumbar vertebrae. So that's what this vertebra prominens is. His long spinous process has large transverse processes, and the ligamentum nuchae here is an elastic ligament which extends from C7 all the way up to the skull, and it inserts in the skull on those superior and inferior nuchal lines. And so that ligament helps to keep that lordosis in your cervical spine and allows you to have your head level. Thoracic vertebrae are next. You have 12 thoracic vertebrae labeled T1 to T12. Thoracic vertebrae have heart-shaped bodies like that. They have a larger body than the cervical vertebrae because they're beginning to hold more weight, but they have a smaller vertebral foramen because the spinal cord gets smaller in the thoracic region, and then it continues to actually decrease in size as you go down the spinal column. It has a long, slender spinous process, and the spinous process points posteriorly and inferiorly. And it's got these large transverse processes, and then it has something special that no other vertebrae has, which are these costal facets. And the costal facets are for the articulation of the ribs. So the superior and inferior costal facets, which are here on the body, are for articulation with the head of the rib, which we'll look at ribs in a few minutes, but the articulation of the head of the rib comes in to the vertebral body. And then, oh, here I can draw in white. So this would be the head of the vertebrae. Hold on. Here. No? All right, I guess that doesn't want me to draw in white. So the head of the vertebrae comes into this superior and inferior costal facet here, and then at the tubercle of the rib is going to articulate with that transverse costal facet. So the rib articulates with these thoracic vertebrae in two places, at the superior and inferior costal facet and the transverse costal facet, which are on the transverse processes. So I just talked about that. So here's the superior costal facet, the inferior costal facet, and the transverse costal facet, which articulates with the tubercle. That's what it is, the tubercle of the rib. Ribs T1 to T10 contact the costal facets and the transverse costal facets. T1 through T8 articulate with two sets of ribs or two pairs of ribs at the superior and inferior costal facets. T9 and T11 articulate with one pair of ribs. And then T10 through T12 begin transition to lumbar vertebrae. So here we are at lumbar vertebrae. You have 5 lumbar vertebrae labeled L1 to L5. The labeling always starts at the top and goes down. So C1 is the very top vertebrae right under your skull. All the way down to L5 is your lowest vertebrae down here. Lumbar vertebrae are large. They're larger than any other vertebrae because they are holding the weight of your entire body, well, above them. They have oval-shaped bodies. The bodies are thicker than thoracic bodies. They have no costal or transverse costal facets because you do not have any ribs in your lumbar spine. And their vertebral foramen is triangular shaped. The transverse processes are slender and they project dorsolaterally, so back and out to the sides. And the spinous process is short and thick, which you can see, and that's for the attachment of the large muscles in your lower back. The sacrum is a large curved bone. It's a flat bone, so it has two parallel surfaces. It protects your reproductive system, urinary system, and digestive organs. It attaches the axial skeleton to the pelvic girdle of the appendicular skeleton. So the coxal bones are make up the pelvic girdle along with the sacrum. So that's what's connecting the axial skeleton to the appendicular skeleton of the legs. And there are a lot of big muscles of the thigh that attach into the sacrum. The adult sacrum consists of 5 original sacral segments that fuse together, and that fusion occurs between puberty and age 25. Typically by age 25, you are fully mature and all of your bones are fused. Sometimes the sacrum can linger longer. There are transverse lines that are left after the sacrum fuses. We'll look at those on the next slide. So the sacral canal is an opening within that sort of traverses down this way. It's continuous with the spinal vertebral canal. Here you can see these transverse lines that are left over from when the multiple sacral segments fuse together. The sacral cornua are horn-shaped regions that are formed by the lamina of the 5th sacral segment that do not meet in the midline. So the sacral cornua are down here, one on either side, and in between them is the sacral hiatus. So that is the opening at the inferior end of the sacral canal. The base of the sacrum is actually the top, and the apex is the bottom. If you look at the sacrum as an inverted triangle. The sacral ala are the wings on either side of the sacrum, so those would be the sacral ala. The sacral promontory is the very front part of the base here. Right there is the sacral promontory. And the apex is that narrow inferior portion. The coccyx is this tiny little bone down at the bottom that you can see below the sacrum. It does attach to the sacrum by ligaments, and it begins as 3 to 5 individual sacral or coccygeal vertebrae which do fuse together. That's really what I want you to know about the coccyx. Not too much to learn there. Last, we're going to talk about the thoracic cage. So the thoracic cage is made up of the thoracic vertebrae, the ribs, and the sternum. The sternum is the breastbone in the front. The rib cage is just the ribs and the sternum. So thoracic cage includes the thoracic vertebrae. The rib cage is just the ribs and the sternum. Thoracic cage functions to protect the organs in the thoracic cavity, which are the heart, the lungs, the thymus, and it attaches muscles of respiration, muscles of the vertebral column, muscles of the pectoral girdle, and the upper limb. So lots of muscular attachments into the thoracic cage. Ribs are mobile and shock absorbing. So if somebody were to slam into you, say you're playing football and somebody slams into you, your ribs can give way and move in and allow for sort of rebound, so you don't end up getting as injured as you could if they were rigid structures. And they move during breathing, and they move in what we call a bucket handle motion. So if you look at, oops. Well, if you go back to that slide and you look at that bucket and you notice that the handle moves sort of anteriorly and superiorly, and that's how your rib cage opens. So when you breathe in, your ribs move anteriorly and superiorly, and they open and give more space for your lungs. And as you breathe out, your lungs deflate and your ribs move inferiorly and posteriorly. You have 12 pairs of ribs for a total of 24 ribs. Ribs are flat bones. They extend from the thoracic vertebrae anteriorly to the sternum or the cartilages that enter the sternum. There are two types of ribs, true ribs and false ribs. The true ribs are ribs 1 through 7, and the false ribs are ribs 8 through 12. True ribs 1 through 7 have individual cartilaginous attachments into the, keep trying to do this. So individual cartilage attachments into the sternum, whereas ribs 8 through 10 come together and form this combined cartilaginous. So they, all of those cartilages from 8 through 10 come together and enter into the sternum as one. And then ribs 11 and 12 are floating ribs, so they are just very short ribs that come off the vertebrae and then just end. They don't actually have any connections into the sternum. When we look at the structure of a rib, we have the head of the rib, which articulates with the thoracic vertebral body at the costal facets. Below the head is the narrow neck of the rib here. And then lateral to that is the tubercle. So the tubercle is the part that is going to articulate with the transverse process of the thoracic vertebrae at the transverse costal facet. Then the ribs come around at the angle. The angle is where they sort of turn to come anteriorly. The anterior portion is called the body. And the sternal end here is the end that actually comes in to attach to the cartilage that will attach into the sternum. So I went over all of that in the last slide. So here's a nice picture of how that rib comes into the thoracic vertebrae. So this is the head of the rib, and it is articulating with the costal facet on the thoracic vertebrae, and then the tubercle of the rib, which is articulating with the transverse costal facet on the transverse process of the vertebrae. The sternum is a long flat bone. I believe it is a dermal bone. It is in the midline of the thoracic wall, and it consists of 3 separate parts. So the manubrium is the top part. The sternal body is that central part, and the xiphoid process is that lower part. So it goes manubrium, sternal body, xiphoid process. The manubrium is that most superior portion. It is triangular in shape, so it's sort of wider on the top and then comes down like that. It articulates with the cartilage of the first pair of ribs, as well as with the clavicles or the collarbones. The top portion of it, so if I were to draw it again, I would draw it like that. The top portion has a notch that's called the jugular notch, and that is in between where the 2 clavicles come in and articulate at the sternoclavicular joints or SC joints. The body of the sternum is tongue-shaped, It is long and flat like a tongue. It attaches superiorly to the manubrium and inferiorly to the xiphoid process, and it attaches to the costal cartilages of ribs 2 through 7. The xiphoid process is the smallest part of the sternum. It attaches to the sternal body and attaches to the diaphragm and the rectus abdominis muscle. So the rectus abdominis muscle is going to come from the xiphoid process straight down to the pubic tubercle and allow you to flex your spine. When you do CPR correctly, the xiphoid process is often broken. All right, I'm not sure if that just recorded again. So the sternal body consists of 4 unfused bones that end up fusing together around age 25, similar to the sacrum, leaving transverse lines in between each segment, also similar to the sacrum. The xiphoid process is the last part to fuse and is easily broken away when CPR is performed correctly. So this ends our lecture on the axial skeleton. I hope you all stuck with me. I know that was a long one. There's a lot of information in this chapter, so I urge you to use all of the study portions of Pearson online to really get an idea of all of the bones. There's a video for every bone, so you can look at the videos for all the different skull bones, for the different vertebrae, all that kind of stuff. So I would encourage you to utilize those this week. And as always, get a hold of me with any questions, and I'll see you back next week for appendicular skeleton, and the week after that is our midterm exam. I hope you guys have a great week.